Thank you, everyone. Can you hear me? Okay, well, as it was just said, I am Tiana Wolfert, the CEO and founder of the Sickle Cell Reproductive Health Education Directive. We are a brand new nonprofit, and it is the first and only sickle cell organization in the world to solely focus on reproductive health for individuals living with sickle cell disease. So as a patient myself, I'm really interested in this whole idea of digital transformation because I come from a population that has historically been underserved and overlooked. So I'm really excited, and I am joined by 4 amazing panelists. So I'm just going to go down the line and let them introduce themselves, and then we can get into the conversation and open the floor up for questions.
I'm Brian Poteet. I'm the CEO of Continuity Health Solutions. We're basically a virtual care platform offering one solution for any virtual care from RPM all the way through the care cycle. I've been in healthcare about 30 years, and a little side note is that I also am the COO of a dental company, a dental office rather. So I look at healthcare from a complete perspective.
Hey everyone, my name is Murali Kashabaina. I lead a company called Entrigna, which is helping healthcare organizations realize the value of digital transformation. I also play multiple different roles, but at the moment I'm also a chief data officer for Health New England, health insurance payer organization, sibling of Bay State Health, which is located in Springfield, Mass. Prior to that, I was the CTO of Multicare, which is based out of Seattle, 11 hospital system, and I've been in the healthcare for the last decade or so. So I'm looking forward to this panel.
Good afternoon. My name is Nick Aish, and I think I'm the old person here on the panel, but I want to say that I'm actually privileged to be a part of this panel. I come more from an administrator background. I'm retired from Stanford about 9 or 10 years ago, where I was privileged to be a vice president for the hospitals for the first 18 of those years. Then I moved over to the School of Medicine, and I retired as an assistant dean for clinical and translational research. And as a part of that, I had a 2-year commission at the NIH where I was the administrator for comparative effectiveness and community engagement studies. So I am very passionate about the work that this team does, and more importantly, really how it's integrated into the larger ecosystem across our healthcare system. On another note, along with my son and his family, we opened up a vegan restaurant in our small town of Morgan Hill. And so I'm learning a whole new industry through the eyes of my son, which has just been a priceless opportunity. But I mention that because change is always in front of us. There is nothing consistent but change. And as each one of us takes a look at who we are as leaders, and more importantly, transformational leaders, we have to have the courage to take that step out. And through the eyes of many around me here on the panel, as well as my colleagues over the past X number of years, it's a really privilege to be here, Tiana, and I'm looking forward to you moderating the panel.
Thank you.
Good afternoon, everyone. I'm Pallav, CEO and founder of MyEasyCare. MyEasyCare specializes in basically delivering senior care platform. What we focused on is basically a complete ecosystem where we feel that the senior care market has always been not been taken care as the mainstream for innovation or any changes, and that's where we are filling in the gap by bringing more innovation and improving the quality of care for the seniors. They deserve the most actually at this time, and they have never been. Everybody cut corner based on the cost or for some other reasons. And MyEasyCare has actually been doing that to make sure that the seniors get the care the way they deserve. At the same time, we are transforming and changing the market by bringing in more digital innovation, using IoT devices and many other things like that. Thank you.
Wow, great. You guys all have really impressive resumes. I'm a little bit intimidated, so we're just gonna have a pretty laid-back discussion. So we'll just be on a first-name basis. Nick and Pallav, I'm curious to know, how is digital transformation changing the care delivery model? And can you also talk to us about the importance of user adoption for this model?
Well, I can take a first shot at that. And I think My hope here is actually through the next 2 days is that we understand the data science well enough that, like we heard from many of the previous speakers, that we can humanize the opportunity that's in front of us through AI technologies, predictive modeling, et cetera. But more importantly, how do we integrate that into the fabric of the processes within our healthcare system? And for me, AI or predictive analytics, all that comes into play with that, it becomes the enabler that really powers up a greater workforce of multidisciplinary teams that really understand not only the issue at hand, more importantly, how can we improve the outcomes of our patients in the community that they're serving based on the science that we're bringing to term. So for me, it's really looking at evolving that more towards integrating it into the fabric of the system itself that we may be working with, and more importantly, understanding what becomes different in that aspect that's really then advancing the care, not only of the community and the patients, but also enhancing the teams that are a part of delivering that care. Where at some level you may want to see AI as this dispassionate mediator that allows collaborative teams to really have informed information based on a very specific issue at hand, be it the senior population or others that you've heard, that really form the opportunity for advancing that care and treatment. And certainly through the medical crisis that we're all currently going through last, hopefully at the end of that term, but it's hard to say that we've seen that become now more prominent. So it's not just as a matter of fixing a solution, it's how do we embed that opportunity with data analytics, et cetera, to really advance the care and welfare of the community itself. And so that's where I see things changing. And more importantly, I think the evolution of that advancement is a multiplier effect. It becomes mobilizers for teams to really collaboratively understand the presence of who they are, and more importantly, use the data science to be able to advance the treatment for what they're doing in their subspecialties.
Great answer. And like I said, as a patient myself, I'm really glad to hear that you are doing this innovative work that will directly impact the lives of patients. Hal, do you want to take this one?
Yes. As Nick said, humanizing AI and all that kind of things, so these are the digital transformation that we are bringing in onto the day-to-day lives of the patients and the people who need help. But at the same time, there's a very important thing that is that needs to be always keep in mind. The first thing is basically the user adoption. How seamlessly these technologies are going to get adopted by the users without having so much interruption in their life where they are already suffering from something or the other. That's the need, they need care. And the second thing is basically the ethical part of it. The digital transformation leaders has to have an ethical responsibility on the data. IoT do collect a lot of data. And how are we actually handling it? How are we actually doing it? That is the responsibility on MySecure or any other leaders who are coming forth with all these innovations on a day-to-day market. We have to set the standards to make sure that this data is not ever misused or actually add on to their own other problems for those that they never asked for. And so I'm going to give you an example with how MySecure actually helped in transforming and how it is actually managing and improving the quality of life with a very seamless user adoption. Imagine a senior who actually goes to the bathroom in the night at 10 p.m. and he doesn't come out in 30 minutes. There can be a lot of things that may have happened, and the senior is basically maybe living alone in the house. He may have fallen down or anything. How to actually help him out on time so that his life can be saved. With our devices, which actually track the opening and closing of the doors at the timing and managing the pattern, at what times does the person sleep, can actually easily identify this person is not supposed to be in the bathroom for more than 15 minutes late at night and 10 p.m. So an alert can go out and a command center can actually call in to find out the well-being of that individual. And at the same time, this whole adoption that happened does not interfere with the life of the senior because the door that is actually monitoring or the bed or the sleeping patterns that are monitored has nothing to do with or anything embedded on his body or he's carrying it or he has to worry about. It's all around him and it's doing the same thing what he's normally doing, yet a quality of care has been improved. Now, another thing is basically the care delivery model is actually changing also. And patients are actually changing to that. But how easily can we do that? Say, for example, Google Home and Alexa can actually do the medication reminders. Mary, take the green pill. Mary, did you take the pill? And 3 times, no response, then a caregiver can be dispatched out to make sure that the medication is administered on time. So this is how the digital transformation has to happen, where the user's life are not disrupted. Care delivery model gets slowly adapted by the users without having any effect, and then a huge ethical responsibility on how the data is handled and who is getting the information and how are they managing it. So that's what I would say. Thank you.
Wow, thank you. I really appreciate that example. It resonates with me, and I'll definitely be putting my grandparents on your radar for this work in the future. But I also appreciate, as a patient, that you brought up the ethics, because I could certainly tell some horror stories about how my data has been mismanaged. So I really appreciate that. Morali, I'll come to you next. Can you tell us how healthcare providers and payers are implementing digital transformation initiatives?
Thanks, Tiona. That's a great question. Actually, it's hard to answer that one, but I will take my chances at it. I do have experiences from both provider side and payer side. But before answering that question, I would like to emphasize the fact that when we talk about digital transformation, what exactly are we emphasizing on? Is it the digital part or the transformation part? So I think if you look at what occurs in the industry, the buzzword is on the digital part, but that won't really help out on any front. If you take a technology and try to look for a problem, that's not the right way to do it, I guess. But healthcare industry in general, particularly on the provider side, they have realized the fact that the emphasis should be on the transformation side. So they are looking for how or what they can transform within their operations, business practices and whatnot, clinical practices and whatnot, and then trying to adopt a particular technology or a technology solution. So just to give you an example, 4 different areas where providers are heavily focusing on right now. The first one is patient experience. Patient experience is so foremost at the moment that because of the general trend, particularly because of the COVID, in fact, the acceleration that happened because of COVID in adopting telemedicine and the fallout of adopting telemedicine, where now providers realize that patients are really tech savvy in some way or the other, and then they are trying to enhance that experience through additional digital solutions. So patient experience is definitely at the forefront. The shift in the narrative from illness to wellness cannot be underscored or underrated that way. There's a great emphasis on wellness. Because of the consumerization and other solutions emerging, there is great emphasis on wellness. And providers are really at it, trying to ensure that they can do some transformation on their side, set up digital front doors where patients can get access to right information at the right time from the right sources, so that they can go on a path of wellness rather than trying to get to hospitals, clinics and whatnot, trying to get their illnesses cured. The second important thing is the provider burnout. No one talks about it. I think the last speaker did emphasize on the burnout not only because of COVID, but even before pandemic. There was 40% population of providers that were under tremendous duress. They were almost suicidal in mindset, actually. So, of course, with the advent of COVID, that added a lot more pressures on that one. So at the moment, providers are also looking at how to alleviate the situation on the ground and how to leverage information and digital solutions to make providers' lives, clinicians' lives better. How to ensure that they have the right solutions in place. Some organizations are adopting clinical collaboration tools such as Perfect Serve, wherein they are enabling integrations with EMR so that providers have very accurate information about their schedules, and then collaboration that happens among themselves. So that is a good example of a digital solution. The third one I would highlight is the general outcomes, meaningful outcomes. That is where the so-called value-based care is taking a lot of emphasis. Obviously, providers are always under pressure from payers to lower the cost, but at the same time improve the quality of care. So that there itself is a problem actually. How can one do that? So that is where providers are definitely emphasizing on adopting digital solutions and trying to ensure that they solve for such problems. Of course, the last one, but not the least one, is internal efficiencies. We all know that the meaningful use program that was introduced in 2009 was ended in 2016-2017 timeframe. So healthcare organizations, particularly providers, are fairly new to the so-called digital footprint, wherein they actually started leveraging EMR systems more recently. Like until 2016, some of the organizations did not even have EMR. So they were heavily paper-based. So even today, they do have paper-based solutions. Take faxing, for example. How many of you know that faxing, in order to do faxing, there are reams of paper that is utilized today every month. Because that is the extent of paper-based operations that are carried out today. And definitely providers are looking at improving the state of affairs, eliminate the paper-based, go for digital solutions, eliminate faxing but use a digital faxing solution perhaps, and things like that. And on the payer side, the recent price transparency mandate that came into picture is creating havoc, for lack of a better word. They are struggling right now to ensure that they continue providing the reasonable pricing as far as claims and whatnot are concerned. And they're definitely looking at value-based care as well at the same time. They also want to lower the cost. They always look at MLRs, the medical loss ratios, which is a metric of percentage of premium dollars spent on actual medical expense or medical care. So that there's a clear mandate on that one. So all in all, both providers and payers are really looking at digital solutions, trying to ensure that they prepare themselves for the next decade or so, right? The pandemic obviously helped them to accelerate the digital program to some extent, but there is a lot of room for improvement, and both providers and payers are looking forward to creating that transformational environment, leveraging some of the new technologies. So, thank you.
Thank you. Okay, well, Brian, we're coming to you next. And as you said in your intro, you have a really interesting perspective because you're in oral health care. So I'm curious if you could talk to us. We know that the COVID pandemic has really changed the way we do basically everything. So can you talk to us about some of the challenges you've seen in getting evidence to providers? And also, when we're able to overcome some of those challenges, what are you potentially able to do?
Thank you very much. COVID taught us very simply that things have to move very fast. The variants, those pieces. When we listen to digital transformation from our peers next to me, and we talk about these processes, the adoption of these programs internally for providers doesn't happen overnight. And what COVID taught us was data is going to come very quickly. And is there methodologies out there? If you look at the architectures of EHRs and a little history, 20 years with Siemens, 5 with McKesson, know EHRs very well. The challenge is that to implement these processes that we're talking about with digital that are going on, and then have COVID hit, and the science change so quickly, is the architecture that we're consuming or those EHRs getting up to date? What's the impact to the provider? Is he getting near-time data? I mean, it's an architectural discussion, right? Because we don't centralize evidence-based protocols. They're not out there in the central cloud, maybe being consumed by an EHR. But if you look at the public data and public health data that was coming down, fundamentally, I think digital transformation as leadership, we have to look at the ways that if it changes this and this time frame, how do we architect systems, put the systems in place that we can get that data down to that provider that's being burnt out to make sure that he's getting the decision trees that he needs to actually execute properly based on that information. Because otherwise, he's always behind. And so, I'll give you an example, because it's not traditional for us to do things this way, right? In 2019, we secured a contract with American Heart. They have about 2,000 assets, 9 curated templates. And how many people have ever been on one? And the point is that it took us 18 months to incorporate this content. But fortunately enough, in the fall of 19, we signed a contract with them. And in January of 20, we had started adoption from innovators. So it took us 18 months for us as a company to adopt, to curate the assets, put it in a format, a delivery time of 12 to 18 months. We took down to a month. So it's not that we had the WHO data or COVID data coming through Ally or in Ally, but the principle of the architecture is we need to rethink how these EHRs consume content. And as leadership, I think that takes the ownership is on us to create, I mean, Epic's a behemoth, Cerner's a behemoth. I worked for Siemens for many years, but they're not selling EHRs today. So behemoths don't intimidate me because it's people in the room we're in with good ideas who can apply them and execute them that I think transform where we go forward. And on that note, and when we talk about evidence-based protocols, what AHA was able to see was the consumption of the data, what assets were being used, the quizzes that were coming back. So they had a method to churn the data and continue to evolve it. That's just one example of someone who creates content that's evidenced, right? And the second piece of that puzzle is we are never going to achieve the optimal care of a patient if we don't include the whole body. And that's the reality. My oral health status, my mouth, there is $115 billion in medical savings in 5 pathways. That's not just getting your teeth clean, that's periodontal disease, which about 110 million people have. So, and it doesn't go away. My point's is simple. They're 2 different billing systems. Everything, it's one body, and we deal with these, this is what we deal with, right? Whether I poke a iliac and go up and squirt LAD, whether I go down and shoot the peripherals, it's just who I'm billing for, whether I'm a peripheral radiologist or I'm a cardiologist. And so, unless we look at the solution and design a solution for that, we can't achieve the end goal. So.
Tiana, maybe if I can add to that, because this really sparks at least one of my brain cells that's still working this afternoon, is we think about transformational leadership, change management piece of what we're talking about here and how it integrates into digital transformation. From my mind, there's 3 types of change. There's transactional change, which is kind of process improvements within a certain defined area. There's transactional, where you're going from a current state to a new state, but that new state is known. And transformational change is really kind of taking that leap to the unknown. And this learning from our last speaker, and I really appreciate her talk and her reinforcement of that human condition. The medical advance, and we should take a pause and a mindful moment just to reflect the medical advancements, the research and the discovery and the adoption over the last 2.5 years based on the medical crisis is really unparalleled. And we should all be very proud to be a part of the healthcare system that had a participation in that effort. So that was one thing that it sparked. But I also think that it also allows us to really examine that human touch. And the example you gave for patient experience, some days back I had responsibilities at Stanford for customer service, just to show my age. Now we call it a patient experience. But as we're going through digital transformational opportunities and technology to enhance that effort for our patients, the families that we were bringing into our organization, we had to understand the transformational piece of that was also understanding the value component, the behaviors and the interactions that need to be incorporated into that AI process or that digital transformation that truly elevates it to the different level. And what I've seen, Tiana, over the past really 2.5 to 3 years is that mindset's being changed. I heard an earlier speaker talk about a new world thinking, right? And I almost hate to think about the old norm versus the new norm. What I can live in today is I know what today's reality is, and it may be a predictor of what's tomorrow's reality is, and how we incorporate that into transformational leadership and the digital aspects of what we're talking about today becomes a critical force of nature that I think I'm fairly very confident is only going to accelerate in years to come. But this is the type of conversation that allows great individuals with brilliant minds to understand there's greater good in front of us, and if we can pull our thoughts together and understand the components of what that change will look like and how it needs to be felt at a human level, then we're truly advancing where we need to be, whether it's AI, predictive modeling, et cetera.
Wow, thank you. And that was actually the perfect segue into my final question, because one of the things that I love about conferences like this is the opportunity to really network and learn from each other. So some of you have already done it, but I would really like to hear examples and strategies that you as leaders have used to overcome some of these barriers and implement digital transformation. So whoever wants to go first.
Tiana, I'm going to take that first. This is what I have experienced on when we started some kind of initiative. And the first thing we notice is that if people don't know what good is, they think what they know is good. So that is the kind of fundamental thing that we have to be aware of when, as leaders, when we go about bringing the change. So there is, as Nick mentioned, there is a fair amount of change, organizational change management that goes with any kind of change, regardless whether it is transformational, translational, regardless whatever type of it. So my approach has been to ensure that when we get onto a path of transformation or a change, the most important thing to highlight is the expected outputs and outcomes. If those are not highlighted, the folks that need to do the work or the folks that will accomplish the work will have issues always questioning, so what? Why are we doing this? What is the purpose of this? What is this for me versus for the organization? So that's a key important thing to bring that kind of visibility. And I always quote this marvelous example kind of, from the past. When President John F. Kennedy visited NASA in 1962, he visited a little late in the night, and he ended up using a washroom, and he saw someone mopping the floor. So obviously he got curious and asked the question, why are you working so late? So that someone, the answer that someone provided was profound, right? So the way that someone answered was that, Mr. President, you know that we are all working hard to put a human on the moon. And this is coming from someone that was mopping the floor. So you can see the purpose. You can see the line of visibility. You can see the the change advocacy that worked in that organization, right? So emphasizing on outputs and outcomes, I think, is so critical when it comes to motivating the people to rally around a cause, to take up a specific task, and then ensure that they get motivated to do the right thing and doing the thing in a right way. So that's my take on that one, as far as I'm concerned,
Yeah, Murli, I just want to add on to that. This is a very interesting point that you talked about, the purpose of what are we solving here and what the digital transformation is bringing. Let's not forget one point here. Everybody's bringing in the digital transformation to reduce the cost by reducing the manual labor or introducing an AI to enhance the experience. And all this cost actually is getting saved. As a digital transformation leaders, I think it's everybody's responsibility is basically these cost savings should trickle down in one form or the other to the end recipient who is actually receiving the care. A lot of times those things actually do get disappear, and that happens. And that is something that also needs to be kept in mind. And the other part of it is basically when the care is actually provided, it should not be only the one way that we are doing it, or a lot of times it happens when some kind of a solution that goes too big, they force the users to align with their processes. That is also kind of make the things a little more difficult and challenging for the patients to actually, when they receive the care. And I'm talking about the self-service care model that is getting more and more common nowadays. The common tasks and activities like medication administration or a daily monitoring, or maybe Alzheimer's or dementia patient who is getting a daily exercise through the AI models. There are a ton of products out there who actually does that. But a lot of them, what they do and they miss out is basically the client or the patient has certain limitations, and we have to overcome those similar limitations by changing our processes rather than forcing the patient to change according to our platform. That's very critical as well. So I just wanted to add those things.
No, that's a great point, Pallav. Actually, I totally agree with you. More recently, I was questioned by someone to define healthcare in one line. So my answer was that healthcare is health delivered with care. That was my simple answer, because at the end of the day, it's all healthcare is for the humans, by the humans, using human interfaces with warmth, empathy, and whatnot. So ultimately, healthcare is all about delivering health with care, right? So I echo your sentiment there.
I can give you maybe another real-world example. I'm privileged right now as we speak to work with the University of Michigan graduate students and Michigan Health on designing a predictive analytics system for the hospital supply chain. And like many may realize in this audience, the supply chain prior to the pandemic from a hospital perspective or healthcare perspective was fragile. It completely broke during the pandemic. And talk about stress and burnout of individuals on the front line. The supply chain executives, we lost close to 35 to 38% of them over the course of the first 18 months because of burnout. But the first thing that we would always do is listen and observe, right? To absorb what is happening within the organization's pain points, to be able to design a digital transformation system that makes sense. But in this case, what we did was we took the graduate students and we embedded them into the hospital. So they understood from a supply chain perspective the operations and the mechanics of what has to happen every day for effective patient care. But more importantly, we advanced them into understanding what the impact was if a clinician, be it a nurse or a physician, did not have that supply, and potentially the outcome to the patient by not having that supply available. So a part of that work initially, Tiana, was actually just learning the process for both cohorts to be able to understand then really how to design a system that's not only effective, but that can be scalable, right? And it's pertinent as it relates to the viability of where it needs to be long term. And that is something that I've seen over the past several years has taken much more of a front and center approach. So as I have a chance to work with young innovators, as we have in our audience today, on trying to translate their innovation into the healthcare environment, the first piece of action is always ensuring that we've embedded them well enough into the patient-centric mindset to understand that if we're designing this technology from this principal aim, is it really going to provide the value ultimately to the patients that they want to serve or the clients that they're going to bring in. So those are real-world examples that are happening as we speak today, but more importantly, I think they're maturing because of the situation that we've all been through over the past 2.5 years. And my hope is we don't fall back to those traditional, what I almost hate to say, normal practices in the past, because we, as professionals and leaders, we have to adapt to where we need to be. And I'm a strong believer that when passion and purpose collide, greatness happens, and that's what you're hearing throughout this conference, is that collision is creating, serving as a catalyst for greater advancements in digital transformation.
Awesome.
100% agreed with you. I mean, that's what we are trying to do. Let me give you an example about MyZCare, the way the technology is working in improving the health of the individual patient. Imagine a senior or a patient is walking down the room, from one corner of the room, from living room to the dining room in 7 seconds, and every day he crosses that. Now, all of a sudden, he started crossing the room, and we are documenting the time based on the motion sensors in the room. It all of a sudden slowly goes to 8 seconds, 9 seconds, and then it goes to 14 seconds, crossing that room. Kind of a trivial, like 47 seconds, 14 seconds, how much of the difference that it make? Even the patient doesn't even notice that. He sits on the couch and spends 2 hours on the TV, and all of a sudden he's taking 3 hours and 4 hours on the TV. Still he doesn't notice it. Our system actually takes on those patterns and notices it, matches up with the diagnosis code, and find out that this guy has got arthritis or diabetes, maybe has a swelling on his feet or something like that, and actually can raise a flag and send a message to the PCP and say, you need to get him in for a checkup and see if his diabetes is in control or not. Those are the things, a beautiful, self-serviced, quality of care, improving the quality of care, digital transformations can easily be implemented and can change the lives. Before, the diabetes may have gone out of control, or some other problems may have gone out of the control. With our early warning system, we can capture that. Now, all these things and innovations comes with a huge responsibility. We take the data very seriously. How we manage the data, it's very seriously, and how and what are we doing with that data is also, we take a lot of time to actually make sure that it doesn't get misused anywhere. So I think those are the things that anyone who is actually, everybody's working on the healthcare side of it, improving the lives of the patient, I think that is something that has to be kept in mind all along. One more thing I have seen in the industry trend that's going on, everybody wants to jump on the AI bandwagon. Everybody wants to do ML. Everybody wants to do something. But got to ask the question, are you really making a change? Are you really improving the lives of the patient? And are you just making an add-on to something that is not even needed and you are making a necessity out of it? These are the real critical questions everybody should be asking to themselves and to what they are doing with. And then only we can actually have the true digital transformation in the most meaningful way that can actually improve and make the betterment, help and work for the betterment of the patients, actually.
Thank you. Great point. Always good to keep the patients at the center, the head, the end, everything. So we have 5 minutes to open it up to audience questions. So if anyone has one, please come up.
I have an urgent question, and I hope you can solve that in 2 minutes. My question is the following. How can digital transformation actually prepare us or make us cope with a dystopian future where we are attacked by a virus that compromises our intelligence? How do we handle that? Can digital transformation help us with these not so impossible possibility?
I can take that, actually. That's a very good question, actually. So the digital transformation is actually doing that. If you think about your exposure tracking, before COVID, nobody knew about the exposure tracking, right? We have got this exposure tracking. Then basically, we have another thing which is called the tracking online or remotely somebody's patient's health without getting close to him in a close proximity and getting the other person infected. And then when all these digital transformation, when you're collecting so much data, I think it will be a lot more easy to find or track the trend on a pandemic or epidemic at a very early on a stage to nip in the bud. But with the absence of all this, these things keep happening and then it's spreading. So I think that can actually make the huge change in, with all these new viruses coming. And God knows what else can come and what's in the store for us in future, you know.
Yeah, let me actually I echo what Pallavi said, but I will just add a few more things to it. I'm going to pinch my right hand with my left hand, all right? I just did, and I can feel the pain, right? And how did that happen? Because I signal right there from this organ to my brain, and brain was able to process it right away, saying that there is a pinch on my right hand, right? And it also knows that it was caused by the left hand. So why I'm saying this one is because there are so many signals flowing through the data that we receive. So a good example is a surge in the claims. I'm just giving an example from a payer point of view. With certain diagnosis codes, what does that indicate? And we know that claim, we know the member, we know the region that member is from, is specific to the zip code, obviously, right? And then likewise, from a provider point of view, there's enough data that flows through it. And if we tap it in a way that we can extract that signal, understand that signal, will definitely help us predict some of such events happening, right? Even before the event really proliferates, we can do that. But obviously, in order to do that, we need the digital infrastructure to tap into that one, apply the AI and other processing capabilities, and generate the signals. So it's not just about that one, right? Any other signal, when you do the correlations, at the end of the day, you get a signal advantage. Just have to tap into that one and use it for some specific purpose. In this use case, you want to know whether there is an outbreak. Yes, that can be done, but we need to have the right data coming in at the right time, and there is digital support to process it using AI and other technologies so that we can predict it in advance of the event happening.
You know, the other thought, that's a great question. That is a great question. And at some level, what we may be thinking about is resiliency. And really, how are we building the architecture where there's resilience built into it? And resilience from a perspective of not how we're getting through today with it, but more importantly, how do we navigate the peaks and valleys that will come in years to come? And much of the digital transformation efforts that we've seen up to date, it's not in its first generation. It doesn't happen in the first generation as far as its optimal performance. It happens on the second or third generation based on adaptive design. So if we maintain that presence of mind that we will continue to iterate this based on the knowledge that we not only have today, but what we can predict in the future and act on that, then I have some confidence that we can solve some of these issues in the future. So that's a great question. It speaks to me about resiliency, and it also speaks about adaptive design. But having said that, it also takes the courage of individuals and companies to be willing to iterate, not today, but a year from now, 2 years from now, to continue that effort based on the data science that we have in this room and others, to be able to continue to mature that. That's a great question.
The last point I'd add, actually, is that even if we identify the signals and we process those, we've got to get them down to the end point. And the endpoints are so distributed. There's so many different applications, right? So if we're not designing a process that we can get that content down to all those distributed points, not everybody has my chart. If it's health related, we just have to bring those standards in, like an Amber Alert example. We have to think through the whole process, because if it doesn't get to the end point, we're not solving the problem.
Do you see any readiness, at least mental readiness, to succumb to artificial intelligence as a substitute for decision-making in cases where cognition is compromised. Do you think that this is something of a scenario that we have to acknowledge?
Well, I guess what you're speaking to is what's the adoption rate based on, obviously, good evidence of information. I don't know if I have that answer today, but I still have trust in the brilliant minds that are taking on the challenge, and I do believe adoption comes with trust and authenticity and great constructs, and I do believe that will occur, certainly, hopefully, for my grandkids and down the road. That's the legacy, that's the responsibility that we all have as leaders if we're going to move this forward. It's not about leading today, it's about what we're leaving behind for future generations, and if we can't accomplish that, then at some level maybe we failed our mission. And I know with that we're out of time, right?
Okay.
Yeah, it looks like we needed a part 2, but this was a great discussion.
Thank you, everyone.
Thank you.